Hey everyone, welcome in. Today we're going to deep dive into something that a lot of runners struggle with,
Yeah.
exercise-induced asthma.
Mm.
And all the information we're talking about today is from an article from rockingultra.com.
Awesome.
It's a great blog,
Yeah.
hundreds of articles,
hmm
all about running. Like literally every aspect of running you could possibly imagine. Whether you're a beginner or a seasoned ultra-marathoner,
Right.
they've got it. And also, they're really big into the mental aspect of running.
Cool.
So it's a great resource, I think, for runners who are looking to maybe, get into that right headspace when it comes to training and racing and all that good stuff.
Absolutely.
So our listener today is interested in running, but wants to make sure that this whole asthma thing isn't going to stop them before they even get started.
Yeah, makes sense.
So
Mm.
let's unpack this. You know that feeling when you're on a run
Mm-hmm.
and you're just dying for air?
Yeah.
Like every breath is a struggle?
Yeah.
That's what people with exercise-induced asthma or EIA have to deal with.
Yeah. And actually, to be even more precise these days, people are kind of moving away from the term EIA, exercise-induced asthma, and more toward exercise-induced bronchoconstriction, or EIB.
Okay, so what's the difference? Like, why the change? Is it just like a wording thing, or is there like a real distinction?
Yeah, so it's more about being accurate. EIB is really highlighting what's going on. Um, Basically what happens is your airways temporarily narrow.
Uh-huh.
It's not the same as like chronic asthma where you've got inflammation.
So it's more of like a sudden squeeze,
Exactly.
not like an all-the-time thing.
Exactly, yeah. And that squeeze makes breathing really difficult, which is what gives you all of those asthma-like symptoms.
Gotcha. So this is something that's been kind of a head-scratcher for me.
Yeah,
Exercise is supposed to be healthy.
right.
So why would it cause breathing problems for some people?
Yeah, it's kind of ironic. So when we exercise, especially if we're doing something pretty intense, our breathing changes, right? We start breathing more, and a lot of the time, we start breathing through our mouths more than our nose,
Yeah.
which means we kind of bypass all of those awesome things that our nose does to like filter and warm and humidify the air that we're breathing.
Right, it's like our natural air conditioner.
Exactly. Exactly. And so without that, our lungs end up getting hit with this like blast of cold, dry air, which can really irritate things down there and trigger those bronchial muscle spasms.
It's like brain freeze for your lungs.
Exactly.
Yeah, that makes sense. And doesn't our body also sometimes release like inflammatory things too that make things worse?
Yeah, sometimes you get these inflammatory mediators that get released and can kind of add to that whole tightening and narrowing of the airways.
Wow, so it's like a double whammy.
Yeah, for sure.
Okay, so cold air we know is a trigger.
Mm-hmm.
What else should people, especially somebody new to running like our listener today, be on the lookout for?
Yeah, so along with cold air, definitely pollution is a big one.
Hmm.
Allergens like pollen
Yeah.
can be triggers. And then just in general, high intensity workouts, so things like sprints or hill runs where you're really pushing yourself, tend to exacerbate things.
Okay, good to know.
Mhm.
So how do you know if it's EIB or if you're just out of shape?
Mm.
What are the signs? Like, how do you know what's going on?
That's a great question. It really comes down to being aware of your body.
Okay.
So some of the classic signs: shortness of breath, even if you're not running that hard.
Hmm.
You might find yourself coughing either during your run or maybe afterward. Some people even wheeze when they breathe out.
Like that whistling sound?
Yes, exactly.
Okay.
You might also feel chest tightness, like there's a band around your chest, and fatigue, like you're just way more tired than you should be for the effort you're putting in.
It's not just about the breathing.
Right.
It's about that overall energy too.
Exactly, yeah. And here's something that can be tricky, especially for someone who's new to all of this. Sometimes the symptoms are delayed, so you might feel totally fine during your run, but then a couple hours later, you start feeling those symptoms coming on, and then it can be hard to connect the dots.
Oh, that's sneaky.
Yeah, it can be.
So let's say our listeners like, okay, I think this might be me.
Mm-hmm.
What's next? Like, how do they actually get diagnosed with this?
Yeah, so first and foremost, see a doctor.
Of course.
Don't rely on Dr. Google or your own self-diagnosis.
Right.
Your doctor's going to take your medical history, they'll ask you about your symptoms, and then they'll likely run some tests.
Okay.
One of the common tests is spirometry, which measures your lung function.
Mm-hmm.
They might also do what's called an exhaled nitric oxide test, which looks for any inflammation in your airways. And sometimes they'll even have you do like an exercise test in a controlled environment where they can monitor your breathing and see how you respond.
Okay, so they're really trying to get a clear picture of what's going on. This is all starting to sound a little overwhelming.
Yeah.
Like, if you have to go through all this, is running even worth it?
Yeah.
You know what I mean?
That's where resources like Rocking Ultra can be super valuable.
Yeah.
They do a great job of breaking down these complex medical topics in a way that's easy to understand. So you can really get a grasp on what's happening in your body and how to manage it. And it's also important to remember that you're not alone in this.
Right.
There are tons of runners out there who deal with EIB. And Rocking Ultra is great for that too, because they really emphasize the mental side of running.
Exactly. Yeah, which is super important, especially when you're dealing with something like this.
Exactly. Having the right mindset, knowing your options, building a solid support system, all of that can make a world of difference.
Yeah, absolutely. Okay, so we've talked about what EIB is, why it happens. Next up, let's get into the nitty-gritty of managing this thing and even how to prevent it.
Awesome. Sounds good.
We'll do that after we take a quick break.
Cool.
Okay, so we've talked about what EIB is and why it happens. But now let's get to the stuff our listener really wants to know.
Yeah.
What can you actually do about it?
Well, the good news is you don't have to give up running.
Okay, good.
There are a lot of ways to manage EIB and still enjoy the sport.
Okay, give us the rundown. What can people do?
So first up, medication.
Okay.
Think of it like backup for your lungs.
Okay, like a safety net.
Exactly. A lot of times, people with EIB are prescribed what are called short-acting beta-agonists, like albuterol. And those are those quick relief inhalers.
Yeah.
And you take them about 15 to 30 minutes before you exercise to help prevent symptoms.
Okay, so it's like a pre-run ritual for some people.
Exactly, yeah. And if your EIB is a little bit more persistent, you might be prescribed what's called a long-acting bronchodilator, which gives you more extended relief.
Gotcha. What about people who have regular asthma as well? Do those medications come into play at all?
Yeah, so for those folks, they might also be prescribed inhaled corticosteroids to help manage that underlying inflammation.
Right.
And there are also medications called leukotriene modifiers, like montelukast, which can help reduce your airway sensitivity.
So it's not like a one-size-fits-all. There are a lot of options, and your doctor can kind of help figure out what the best one is for you.
Exactly. Yeah, it's very individualized.
Okay.
But medication is just one part of the picture.
Okay.
A good warm-up is super important for anyone with EIB.
Right.
And even more so than for people who don't have it.
Yeah.
And it's not just about warming up your muscles. You're actually warming up your airways, too. You're kind of gently easing them into exercise instead of just shocking them with a sudden burst of intensity.
Yeah. That makes sense. I've definitely noticed, even for myself, a good warm-up can make a big difference.
Absolutely. So for someone with EIB, a good warm-up might look like 10 to 15 minutes of very slow jogging.
Okay.
Not race pace, just really easy. And then following that up with some dynamic stretches, focusing on really opening up your chest and back. And this can actually help induce what's called a refractory period.
Okay. What's that?
So it's basically a window of time where you're less likely to experience symptoms. And Rocking Ultra actually has some really great articles on different warm-up routines, specifically for runners with EIB.
Perfect.
Oh.
Okay, so we're warmed up and ready to go. Now we got to think about where we're actually running, right?
Absolutely, yeah. Environment plays a big role in this too. So if cold air is a major trigger for you, wearing a scarf or a mask over your mouth and nose can make a huge difference.
Okay.
Because it helps to warm and humidify that air before it gets to your lungs.
Right, especially in the winter.
Exactly, yeah. And then if things like pollution or allergens like pollen are issues for you, you want to be strategic about where you're running.
Okay.
So maybe that means choosing routes that have better air quality, maybe running at different times of day when pollen counts are lower.
Right, so it's be smart about where you're running and when.
Exactly.
Okay.
Don't forget hydration too.
Oh, right, of course.
Staying well hydrated helps keep your airways moist and less irritated.
Okay.
If you're dehydrated, your body is already under stress.
Right.
So it can make your EIB symptoms worse.
So hydration is always important for runners, but it sounds like especially for those with EIB.
For sure. And then this might sound a little surprising, but the way you breathe can actually make a difference too.
Really? Are there specific breathing techniques that can help?
Yep, absolutely. So during your warm-up, you can try focusing on nasal breathing.
Oh.
Because like we talked about, that helps you humidify the air. And then once you're into your run, you can practice what's called diaphragmatic breathing.
Diaphragmatic breathing, I've heard of that.
Yeah, it's basically breathing from your belly, not your chest. So imagine like you're inflating a balloon in your belly,
Okay, yeah.
not just your chest.
Got it.
So that engages your diaphragm more effectively, which can help improve your lung capacity and efficiency. And again, Rocking Ultra has a whole section on different breathing exercises.
They do. That's awesome.
Yep, with visuals and step-by-step guides.
I love that. It's like yoga for your lungs.
Exactly. Okay, so let's say you're doing all the right things.
Mm-hmm.
You're taking your meds, you're warming up properly, you're being smart about your environment, you're staying hydrated, you're practicing good breathing techniques.
Okay.
But you're still finding that running is a struggle. What else can you do?
Right.
Well, that's where cross-training can be a really great option.
Okay.
So things like swimming, cycling, rowing,
Mm-hmm.
these activities tend to be less likely to trigger EIB
Okay, why is that?
because they don't put as much demand on your breathing.
Okay.
And a lot of times they're done in more controlled environments.
Gotcha. So it's like you're still getting a great workout.
Yeah.
But you're being a little kinder to your lungs.
Exactly. And I think that's a big part of managing EIB, finding that balance.
Oh, great.
It's a journey. You got to listen to your body,
Okay.
be flexible, and, constantly learn what works best for you.
Totally. And Rocking Ultra can be a great resource for that too, right?
Yeah.
Like they have tons of stuff on EIB.
They do. They have a ton of resources, articles, personal stories from other runners who deal with EIB. They even have forums where people can connect
Oh, nice.
and share tips and support each other.
That's so helpful because it can feel really isolating when you're dealing with something like this, I imagine.
Sure. Yeah.
So knowing you're not alone is huge.
Absolutely. So speaking of being proactive,
Right.
let's talk about prevention.
Sure.
What can our listener do to kind of stay one step ahead of EIB?
Right. Because that's the dream, right? To like prevent it from happening in the first place.
Totally.
Prevention, that's the dream, right?
Yeah.
Like how can our listener try to like minimize those episodes of EIB?
Yeah, absolutely. One simple but really powerful tool is just keeping a symptom journal.
Okay.
So after each run,
Yeah.
jot down how you felt, the weather conditions, how hard you were working, maybe even what you ate before your run. You'd be surprised the patterns you might start to notice.
Oh, yeah, that's a great idea. So it's like you're becoming a detective for your own body.
Exactly, yeah.
Interesting.
And then in terms of your training plan, gradual progression is key.
Okay.
So you want to avoid those like sudden jumps in mileage or intensity
Right.
that can really shock your system.
So like easy does it. Don't go out and do like a crazy hard workout.
Right, exactly. And pay attention to the seasons.
Okay.
If you know that things like cold weather or high pollen counts trigger your EIB, be flexible with your routine.
Right.
So maybe swap outdoor runs for indoor workouts during certain times of year. Or choose different routes. And again, Rocking Ultra has a whole section on training plans that are tailored to different seasons and environments.
Yeah, they really do have everything. So it's like you're saying, it's about working with your body, not against it.
Exactly. Yeah. And of course, your overall health plays a role too.
Okay.
Managing allergies, treating any respiratory infections promptly, just staying consistent with your fitness routine year round can all contribute to a stronger respiratory system.
Right. So it's like this holistic approach to lung health.
Exactly. And again, you can find information on all of this stuff on rockingultra.com.
They're the best.
Yeah.
Okay. So we've talked about managing symptoms,
Yeah.
prevention strategies,
Mm-hmm.
cross-training.
Mm-hmm.
But let's be real.
Yeah.
I think our listener probably has this one big question on their mind.
Yeah.
Can you still be a serious runner if you have EIB?
Absolutely.
Okay, good.
There are tons of elite athletes, even Olympic medalists who compete and excel with EIB.
Wow, that's inspiring.
Yeah, for sure. The key is having that personalized plan,
Right.
managing it proactively, and most importantly, not letting it define you.
So it's not a deal breaker.
No.
It's a challenge,
Right.
but one that you can overcome. You know what I love about Rockin' Ultra is they really have this message of self-acceptance
Yeah.
and empowerment.
Absolutely.
It's not just about like hitting PRs.
Yeah.
It's about enjoying the journey.
Right.
And honoring your body and all that.
For sure. And they have so many inspiring stories about runners who have not only managed their EIB, but have achieved incredible things in the sport.
That's awesome. Proof that you can chase those running dreams even with a few bumps in the road. Okay, so as we wrap up here,
Yeah.
what's the biggest takeaway you want our listener to leave with?
I think the biggest thing is that EIB is manageable.
Okay.
It doesn't have to sideline you from running. Knowledge is power. And with the right strategies and support, you can absolutely thrive as a runner.
Awesome. And Rocking Ultra is like the go-to resource for anything and everything running,
Yeah,
especially if you're dealing with EIB.
for sure.
So check out the site, dive into their articles, connect with their community.
Yeah.
There's so much good stuff there.
Absolutely. They really do make running accessible and enjoyable for everyone, regardless of their challenges.
I love that.
Yeah.
So to our listener, remember, running is a journey, not a destination.
Mm-hmm.
Listen to your body, celebrate your progress, and most importantly, have fun out there.
Well said. And don't forget to check out rockingultra.com.
Yes, it's a game changer.
Absolutely.